Look at this. This is a bright-eyed and bushy-tailed this morning. It's great to see you all here. It's actually remarkable to see so many people here. We're already halfway through the exhausting climate week, but it's terrific that you're here. Thank you so much. My name is Stephen Dunbar-Johnson, and as President International of the New York Times, it is my great pleasure and honor to welcome you to the Times building and to the Change Makers Breakfast, which is themed Climate RX, Preventative Healthcare and Decarbonization. So this morning's discussion is hosted by AstraZeneca as part of the Times' Climate Forward series. This is the first time the Times has partnered with AstraZeneca, and the first ever with a pharmaceutical company. So we are very excited to see this breakfast come to life ahead of our main stage programming in a short time, which is taking place down at the Times Centre. That climate change impacts our health is well established, though arguably many of us here today are still isolated from the world's effects of climate. But what we'll learn more about in this session is how the health industry impacts the climate, a connection that is less well understood and comes with unique dilemmas and trade-offs. But it also comes with extraordinary opportunity. If we can embed health into our climate policies and climate into our approach to healthcare, we have the ability to improve well-being and quality of life exponentially. So I very much hope I will see many of you downstairs after this breakfast for a full day of live journalism on climate and its intersection with business, policy, culture, and more. And I would really like to thank again you all for being here first so early in the morning, and very much AstraZeneca for bringing this topic to Climate Forward and enabling this discussion. So to officially kick off the sessions, please join me in welcoming AstraZeneca's US Country President, Biopharmaceuticals, Joris Silon. Joris, thank you.
Appreciate that. Very excited to be here tomorrow with you all. My first thank you goes to your alarm clocks early in the morning to get you up out of bed and join us for this fantastic event. And thanks for the organizing partner to having us. I'm Joris Silon. I'm heading up AstraZeneca here in the United States, and I'm also responsible for our biopharmaceuticals business. And that business is very much connected to non-communicable diseases. We are very passionate about chronic COPD, asthma, chronic kidney disease, and some of those elements we'll be discussing today of what we can do for these patients. Healthcare has always been a cornerstone of my passions. I've got a master in kinesiology, which is probably more the health side, right? And now I'm working in a pharmaceutical company that's looking at how can we treat people that are more sick, but it's always been a passion for me to say, you know, what can we do earlier so that we care for health rather than caring for sick? And I think if we do that well, it will also help the climate at large. The climate change presents a clear and present danger to public health, we all know that, and it amplifies the risk of various illnesses affecting the respiratory system or negatively contributing to diseases like kidney, as I was talking about. These impacts are felt quite immediately. And we're in New York today, so I was asking the team to give me some numbers. Here in New York, and this is according to IQ Air, poor air quality has resulted in an estimated 9,500 deaths this year alone. Last year when we were here, you might remember, there was smoke coming over from the wildfires in Canada, which is, you know, a clear example that it's not because you maybe not live in some of these zones that are in danger that you're not affected by it, right? These winds carry it everywhere and it affects our respiratory system. In the southern states, another example, I was talking yesterday to an emergency room physician. I was really surprised about how she's in a southern state, how she sees during summertime that the emergency room is crowded by people that are just trying to find a way out of their homes that are getting to 100 degrees plus, right? They can't breathe anymore. The electricity goes down, they can't charge their phones. So you go to an emergency room to get air conditioning, to get water, right, and to charge your phone. That's sort of where we are, which is really underscoring the intersection of climate health with climate with health, and obviously with the social determinants that come with it. So our focus needs to be on the environment, but it cannot be solely about that. If I go back to health, I think if we are able to emphasize prevention, early detection, and optimal treatment, we can really do good for patients, and we can do good for climate and the planet at once. So health is inseparable from health climate. And we are a member of this healthcare ecosystem, of course, and we carry a profound responsibility as a sort of conveyors of change. And there's two things that I want to emphasize in terms of what AstraZeneca is doing. First, and we'll talk about that today, is we want to be an actor of change to move to earlier diagnosis and prevention of diseases. It's good for patients, it's good for the health systems, it's good for the planet. But we also realize that we are also producing carbon and carbon emissions in the health industry. Whilst we're the first responders when people need health, we're contributing to the problem as well. 8% of carbon emissions in the United States is the healthcare sector. That is more than air traffic, which is our responsibility to do something about it. So AstraZeneca is sponsoring this event because of that reason. We have an Ambition Zero Carbon program in our organizations that is aiming to decarbonize everything we do from scope 1 to scope 3 by 90% in 2030. I'm leading a Salesforce team that has a large fleet of vehicles. We have around 6,000 vehicles, and I'm proud to say that 80% of those this year will be electric, and next year we go to 100%. It's just a small example on how we try to do something within our organization as well to help with the decarbonization. So the pandemic taught us also a critical thing. As you know, AstraZeneca stepped up and provided a vaccine for the world. What we learned in that period is that public-private collaborations and cross-sector collaborations are really important if you want to pull this up. That's why I'm so proud to be here as the sponsor and see so many people of the healthcare system in this room, because it's about partnerships, it's about collaboration. Nobody can do this on its own, right? We need each other, and we need each other's help. So today's discussion will be an opportunity to foster some of those new ideas and build relationships with the goal of driving impactful change. So thank you for joining us. We're going to now delve into the important and crucial topic of decarbonizing the healthcare sector through prevention. And I want to especially thank you for our esteemed group of speakers that are here in front of me, Dr. Gaurav Basu, Dr. Cheryl Holder, and Dr. Victor Zhao. Really thank you for being here. They will share experiences and solutions to tackle the climate crisis. So it's going to be an insightful discussion for sure. So I'd like to turn over today to our moderator, Sweta Chakraborty, who is the North American CEO of We Don't Have Time. Have a great further breakfast and a good discussion. Thank you so much.
Okay. Good morning, everyone. I hope you're having a great climate week so far. This is a topic that I have been covering for 15 years. I'm not trying to give away when I actually got my doctorate, but it's hard to talk about having a doctorate when you're in the presence of medical doctors. But I do have a background in behavioral science, and behavioral science is all about how do you communicate in a way that resonates with different audiences, and so that it actually results in behavioral outcomes. In this case, the behavioral outcomes is improved patient outcomes. How do we have patients make decisions that are not only going to improve their individual health, but also community health, and ultimately planetary health. And so there is a science behind communicating science, and what we've learned over these many, many years of communicating to different audiences is that nexus of climate and health actually resonates really well. It's one of those cross-sections that really reaches the widest range of listeners. And so that's why I'm so excited that the New York Times and Climate Forward and AstraZeneca are coming together to host this conversation, because it works. So it's not just about talking, it's about actually resulting and seeing improved outcomes and decarbonization of the healthcare sector. So thrilled to be hosting this conversation and to be introducing our panelists. But before that, I would also just like to say that it really does come down to early intervention. And so the fact that we're having this conversation now during Climate Week New York, during the United Nations General Assembly, in this critical window of time where we can really make impact, that's also, it's not just timely, it's absolutely imperative that we do this. Okay, so I am thrilled to introduce our first two speakers. They will please just come up one after another. Dr. Gaurav Basu is the Director of Education and Policy, and he is the Assistant Professor at Harvard Medical School and the Chan School of Public Health. Excited for your first 5 minutes, followed by Dr. Cheryl Holder, who is a doctor of internal medicine and with the National Medical Association. So, Dr. Basu, stage is yours.
Thanks so much. And let's see, will this click to the first slide? I can do it without it, but. It's a very cute picture, so you gotta see it. Okay, all right, so here I am. All right, look at that young, bright-eyed graduate. I went into medicine with this basic principle that how we take care of people's health is a reflection of how we honor their humanity. And with this basic belief that the world just needs people who are taking care of each other. And I would argue that's what we need today, all these years later, more than anything. And so I went into medicine for this work and became a global health doctor. My family's from West Bengal, India. I've been working with this organization, the Child in Need Institute, working on issues of child nutrition, making sure kids could stay safely in schools and get an education, and working on reproductive health rights along the coastlines of the Bay of Bengal, where there's a lot of health issues, a lot of equity issues. So climate change was all around me, but I'll be totally honest with you, I'm a little embarrassed to say this still, I couldn't see it until the 2018 UN IPCC report. And that was a catalytic thunderbolt moment where all these issues of global health equity that I'd been spending so much time thinking deeply about, suddenly they came alive. And suddenly, as I couldn't see it previously, I could suddenly see it all around me in all these issues I cared about. And I wondered, I knew my life changed. I knew the kind of work I wanted to do had changed forever. I even thought, should I leave medicine? Should I start building solar panels? I didn't know what to do. And after a long journey, I came to realize I needed to continue just to be who I was, to be a doctor, to show up, and to speak about the moral anchoring of how climate impacts health equity. And so with that lens on, I'm actually meeting with the Child in Need Institute today on the sidelines of the UN to continue to work on a mangrove project to help the restoration. Now looking at that community with a climate lens, they're getting pummeled by Cyclone Amphan, Cyclone Mocha, right? These communities are trying to keep kids healthy and safe, good nutritional programs, safe health deliveries. But climate change is a clear and present danger to them. And they're on the front lines as they rebuild their communities to be hit again. And so these are the faces that I see. This is the faces I want the world to see when we think about climate change. So I'll just outline the way I think of it. I like mechanisms. I like things to hold on to understand exactly how climate change is impacting health equity. So this is the impacts of climate change, ecological degradation, air pollution. But I think of it through these 8 ways. Food insecurity, water scarcity, infectious diseases, extreme weather events, heat-related diseases, which are a big bucket, air pollutions, the impacts on mental health, which we don't talk enough about, and then forced migration and social instability. And so today we're here. I'm a primary care doc. I work at a community health center. I ran over here from clinic yesterday. So climate solutions is preventative healthcare. And so many of us, so many of my colleagues here in the audience, we don't want to wait till people are impacted by climate change and sick and coming to us in our clinics. COVID taught us that we cannot do medicine in that way, where we have great public health crises descend upon our communities and we just wait for them to get into the hospitals and clinics. We need to work upstream. We need structural change. We need systems change. And so I'll offer these 3 ways that health professionals are engaging right now. Number 1, we want to be part of the policy discussions. We want to be talking about how to have a clean energy system and a clean transportation system. We're working to decarbonize the healthcare system itself. And we need to have a more proactive healthcare delivery system. So just very briefly, there was 40 million healthcare professionals that signed on to the WHO's call for climate action in the lead up to Dubai. There was a historic Health Day at Dubai, there's an awakening among health professionals. I'm still surprised people sometimes don't see it, but we are activated. We are a community that's building, and we want to be a part of the conversations of embedding health in these systems. So that's at the global level, but we're showing up at the federal level, in our municipal city halls, at the state level. We want to be a part of the conversations because we know these are solutions for our patients. Then there's decarbonizing the healthcare system itself. We have a responsibility to do no harm. We have a responsibility to make sure that the way we're delivering healthcare is sustainable, that we're not causing pollution and emissions. U.S. healthcare system is somewhere between 8.5 and 10% of U.S. emissions, an extraordinary amount, and we can be an institutional anchor of showing how climate solutions occur. And also, medicine, I'll be honest, doesn't do a good enough job of this, of being proactive. Too often we wait for people to be sick and take care of them. During heat waves, Miami doing a great job of this. We can be calling patients and saying a heat wave is coming. We have identified you as someone who's at risk. Here's the things you need to do. That really can make the difference between life and death. We can't wait for people to be harmed. We got to go out into the communities. We got to be calling them. We need to be proactive to make sure people are safe when climate threats are descending upon them. So I'll close with this. We are all here because of our great concern of this extraordinary consequential issue. I think we need to embrace the spirit of transformation and creativity and imagination. People around the world are impacted in extraordinary ways. And we have to do things fundamentally different. And I think I'm hearing people throughout this week saying we have to embrace that spirit of saying things we've done, they haven't worked well enough. Let's think at a fundamental level of how to implement these climate solutions with a spirit of transformation. Thank you very much.
Well, thank you. This one? Oh, there I go. Hi, good morning, everyone. Thank you for coming. Thank you to organizers, and thank you for coming out so early. But I hope we're starting the day off on a high note. So definitely climate solution with an immediate benefit. Dr. Basu did a great presentation. We showed you the connection of the climate change, health, and our society. So let me take you through how that shows up to me in my clinic. I've always cared for low wealth communities, and one day I was in clinic and I was looking at the chart of my next patient, and I'm like, how could this be? How could this patient be showing up as the first visit for end-stage kidney disease? End stage. I've been a primary care doctor for nearly 40 years, and my goal is to prevent disease or diagnose disease early so we can have the worst outcomes. So when I met this patient and started taking the history, I learned so much about him. He had had multiple emergency room use, multiple missed clinic appointments, multiple missed lab appointments, and what happened? So during more questioning, he said to me, I'm no fool now. I tried. I had to stop. I apologize. I'm real sorry. I just want to understand how we got to this place. So he had been diagnosed about 15 years ago while he was incarcerated with high blood pressure. When he was released about 10 years ago, he got a list of clinics and about a month's supply. Only job he could get, he was a construction worker, and unfortunately he lived in a state that did not expand Medicaid. So he was uninsured, no money, tried to get care. Repeated attempts, he couldn't do what he was supposed to do, and despite all efforts, all he did was, as he says, what am I to do? I go to the emergency room when I felt bad. They can't turn me away. So with that, I have a patient who really did do everything possible. And despite everything, he comes into me for the first time for primary care with end-stage renal disease. It was bittersweet when I explained to him that now our health system would give him Medicaid, Medicare, everything would be paid for. How could it be that we could find the money to pay for this gentleman to spend his rest of his life 3 times a week connected to machines? When we look at the overall cost and impact, not just economically, but with our environment, that patient alone, one patient on hemodialysis, puts out about 2 metric tons of carbon dioxide. Think about a car driving 5,000 to 6,000 miles. I use this slide, you'll see typos, it's AI generated, and I just couldn't spend the energy to make the corrections, because I know what that is. Yeah. So when we go forward with our patients and we think, what could we do? Because my patient story is not unique. Similar stories are happening all over this country and worldwide, where we find money, especially for low wealth people, to take care of them when they're sickest, but never enough to advance and prevent disease. Improving our healthcare system, where we prioritize preventive care, would mean lower emergency room use, less energy intensive treatments at the end, a way of connecting with a doctor who could then help that patient, who would help them, their families, and help their communities because they understood how to stay well. We know we're no fools, just like my patient. We know preventive health care saves money. We know preventive health care saves lives. The evidence is indisputable. We have got to integrate preventive health care into what we do as health and prioritize it. You saw Dr. Basu's 8 major things. This is the tip of the iceberg, because look at the cost economically, environmentally, as we unleash the worsening of these conditions. My patients are already experiencing, where I live in Florida, many of these, and it will continue. We have an opportunity to save lives and save money, and obviously save our planet. But I want to end showing you that it is possible, because this is Jorge. That's my real patient. He approved this. This was when he did a thing for the NPR. That's where he lived, concrete, poor ventilation, on concrete, in a city that's only 19% tree canopy, hot. He works outside selling fruits, similar to my other patient who is an outdoor worker. But he was in care. When his kidney disease started showing up, we implemented a plan that saved his kidneys. Unlike my other patient who ended up on dialysis, preventive care was insurmountable, the only way we have to go for a climate solution that gets us health and gets us reduce carbon emission and get everything that you heard about now. Thank you.
While we're fixing the furniture a bit, I would like to welcome to the stage my first panelist, but Dr. Basu and Dr. Holder will be joining us as well. Dr. Victor Zhao, who needs no introduction, but is the president of the National Academy of Medicine. So we're going to ask for your reflections of what you just heard to kick things off.
Great. Well, good morning, everyone. Good morning. That's fantastic. Good. You know, I was just listening to these 2 brilliant presentations. First one captures a lot of my life, because I was born in China, and my families were refugees. So we ran off to Hong Kong, and post-war China, poverty, bad hygiene, illness, you name it. Many of my family members were very sick from tuberculosis and many others. So from very young age, I wanted to go into medicine. And when I was 18, I came over to study in Canada, and then of course I've had most of my life here. But actually listening to them, the passion, certainly I'm a doctor, I'm a researcher, and over the years, I think that I've evolved to, of course, somebody who's involved with many issues of collaboration, partnership, policy, you name it. So when I think about what they do, and all of you in this room, how important it is to get all of you saying this is such an important issue. What I do is in the national academies, we can use a convening power and the fact that we, in fact, were chartered by Congress, but we, of course, now are global in having the opportunity to, in fact, look at how we can move forward things together. So what we've been doing is to say, how do you take these brilliant stories, brilliant young people, and many others, along with AstraZeneca, to say, let's work together. Because I think you can't solve this problem alone. There are many, many great solutions. Every patient, Cheryl, benefits from your work, and Gareth from your work. But we want to scale to such a level that we can learn from each other and do things together. And hence the idea of using academies' convening power to create a thing called a grand challenge.
Sure.
And then a challenge in which we have one on, in fact, a collaborative, that we bring together public-private partnership. The idea here is to say we need everybody on board. So who do we have as partners? We have, for example, I see John Balbus here, Rachel Levine, who's Assistant Secretary of Health, is a co-chair with me, along with Senator Bill Frist, along with now George Barrett, who's the former C.E.O. of Supply Chain Cardinal, because it's a really important issue. And of course, along with Sir Andrew Whitty as well, who's then the now the United C.E.O.
We're really ensuring the private-public mix here.
You got it. And we bring together industry CEOs, hospital leaders, primary care physicians, they both on the collaborate, by the way, and also educators, as well as policymakers, to say, if we're going to do this, we have to do it together. So we set goals together to say, here's what we need to do. You know, we're committing as a collaborative to 50% reduction in 2030 and net zero in 2050. But to do so, we need to learn to work with each other. So we have these 4 groups. One group is looking at how to redesign healthcare. Your point exactly, right? Prevention, change the way you do care in the hospital, reduce the carbon footprint, you name it. Second is actually having industry together say, how do we reduce our footprint, particularly supply chain? And so McKesson and many others are all part of the equation, AstraZeneca look at. And much of what they talk about is a journey map to say, let's talk to each other, learn to do this, and also try to start measuring together what standard metrics, scope 3,
Sure.
you name it. Third is communication education. And this is where we're really working along with many others. Actually, we talked about that last night, to actually enable education. And Maria Nera from WHO's here. She's really interested in also looking at how to enhance our communication platforms so that students, nurses, doctors all learn this, and how we communicate to the public. And the final issue, which I think you guys implied, is talk about is policy. So one of the working groups on policy, we have the Medicare, Medicaid Innovation head, Liz Fowler. We have John Perlin, who's the head of Joint Commission that accredits hospitals. And then we have Don Berwick. Everybody knows Don Berwick, right? And together they're saying, how do you actually move things forward? Incentives, policy. So just an example, CMMI now have launched this called TEAM, and John can tell you more about this. The starting journey of saying, let's voluntarily measure with the idea that probably we're going to give you value-based payment and encourage people to do those. John Perlin's certifying hospitals now to say, I'm not giving accreditation yet, but let's certify those who volunteer. And then, of course, with Don, we launch a whole movement. In April, we launched this thing called Accelerated Health and Climate Movement, where I guess everybody can join. Right now, we have, I think last count, 770 hospitals join us. The idea is to create a whole movement forward. And that's why all of you are so important. One last thing,
Yes.
which is equity. This is so important. And I think in their talk, they really, in many ways, touch on it one way or the other. So we thought it's so important that we feel that communities which are vulnerable don't have much of a voice. So we created a what they call climate community network that actually takes the most vulnerable, marginalized populations. The way we did is we used a heat map with the University of Maryland that maps which are the highest, which are the counties which have the highest impact of climate and socioeconomic deprived. Bring them together, then we bring along our partners, people in this room, philanthropy, government, EPA, HHS, industry, to say, let's help you find resources and co-create solutions. So that's what we do. So I'm so excited to be with these two brilliant young people to kind of bring all the energy, because I don't think you can do it alone. You really have to do it collectively.
Yes, and that's music to my ears. That's what I've been preaching, and my organization has been preaching in terms of connecting dots within sectors. Healthcare is what we're talking about today, but across sectors. So I love that we are learning lessons from food, from fashion, from transportation. All of it is relevant lessons learned. So thank you for those opening remarks for this panel.
I want to jump on your last comment, though.
Oh, please.
Because we're launching an initiative led by Sir Andrew Haynes and Judy Roden, who really are icons in the health field, right? Planetary health. And the whole idea is to bring all the sectors together. As you said, all the other sectors to say, what about health, right? Most sectors look at their issue as consumption of energy, carbon emission, intervention, and then economics.
Exactly.
We are proposing a net zero well-being economics. Asking the question, have you thought about what does it mean to health? If you start measuring the hospitalization, the dialysis, all that stuff, and add in the equation, you know, agriculture, climate, transportation, energy, they all contributing to it. So with a lens of health in all the sectors, want to work together with them. We collaborate with World Economic Forum on that as well.
Nobody has the luxury of staying isolated anymore.
Yeah,
it's too interconnected. The health and climate nexus is a great place to start, though, to really start raising awareness. And raising that awareness with your patients and then with the public more broadly will then result in the policies becoming that much easier to pass. It's really reinforcing.
Absolutely.
So it's a cycle that thank you all for being a part of and stimulating. So with that, I would love to invite back onto stage Dr. Basu, Dr. Holder, and we are going to have a discussion now about pretty much what we have set up, but we're going to dive a little bit deeper into it. And I'm going to throw this out to the panel to start. I'm going to start with you, Dr. Basu, how you think about prioritizing, because you're a physician, so you are working with patients, and so to look at it from the actual individual healthcare perspective versus the bigger lens of public health and all the things that you're doing in West Bengal, and that's close to my heart also, from the same part of India there.
Yeah.
So we have our weird pronunciations of certain names and words. But how do you think about prioritizing from individuals versus bigger public health issues?
Yeah, I think of policy first. You know, I think that the way I size up this moment is that, again, I told you I kind of woke up in 2018 to this, but I think a lot of the U.S. especially woke up in 2018 to this. I think a lot of health professionals woke up in the last 5-6 years, and now we've passed a big bill, Inflation Reduction Act, that is descending into our communities and creating health and climate solutions. But like, it's hard work to actually get into hospitals and get in the guts and get rid of the gas and like, that's actually hard. And we're seeing a little pushback now, right? Where we're saying, well, you know, energy costs are high and, you know, it's going to be too hard to build the rail. And so I think my answer to you is this has to be like the central, if you believe, like I do, we do, that this is the fundamental public health crisis, the defining issue of our time, and I really believe it is, you've got to make it the organizing principle for how you make a society, of how you make a healthcare system, and you got to push through the hard moments. And I think we're in a hard moment right now because, you know, the truth, we have passed these bills, but my patients are not palpably feeling it in their lives.
Sure.
The buses aren't showing up on time. The energy bills are a little too high. Getting induction stoves into their homes, like I'm a renter. You know, these things still, we have a lot to figure out, and you got to grab onto it and make it easier. So if I'm just telling my patients, hey, you know, here's some climate solutions that don't feel accessible to them, I think this next phase is really important of we Honestly, I think there's not enough political credit being received for these bills being passed. Now we have to make it come alive in people's lives in a way in which people can feel palpably that climate solutions improve their lives, their families, their health.
Fantastic, thank you. Dr. Holder, your thoughts?
No, I agree 100%. I mean, policy, unfortunately, is controlled by money and power. And when you don't have that money and power, the policies that we feel would be most impactful now and benefit all of us have difficulty. Yes, this is a huge challenge. If we could continue pushing for greenhouse gas reduction, we'd improve air pollution, we'd save millions of lives. But how do we get that right now into my population? That's where I see the nexus of healthcare, of prioritizing preventive health, getting access. Why would my patient never get access to cheap, affordable blood pressure medicines and a better job, some insurance, and some protection when he works in the heat outdoors? That would have stopped us from ending up on his dialysis. Medicare spends like $3 billion just on end-stage renal disease. There are only about 400, almost 450,000 Americans that are getting dialysis yearly. But that's billions of dollars. So when you look at that, it is so clear that we know which policies would save the planet and save lives and make the difference.
And they're inextricably linked.
And they're all linked.
I'm coming to you on your thoughts on that in just a second. But to pick up on the example that you gave, which was it really resonates. It's really heart-wrenching. And then I had the pleasure of speaking to Reverend Yearwood, who speaks about Cancer Alley and how it could, with the right policies, turn into Opportunity Alley. And so that just goes to show how policies around environment ultimately impact patient health outcomes. And there needs to be advocacy for that. So thank you for advocating for your patients, but then organizations like AMA are really bringing these stories and narratives of those who have been historically disenfranchised, those who have had inequitable repercussions. Those stories need to be presented at the national level so that they make it into federal policy. So how do you think about that?
Well, obviously, policy really greatly influences what we do. I spoke at a recent meeting about how can public health influence policy. I say public health wants to protect health and to advance health using science-based evidence. But it's highly influenced by policy, right? Look what happened with COVID-19, wearing the mask and all this stuff. So you have to be smart to say, how do you work with them? I think it does start with compelling stories and means of communicating the real science-based reason. But you don't simply show slides and graphs, you have to tell stories, right? Kind of a storytelling with data to enable, but you also need to understand how politicians, decision makers think. So someone said, it's not evidence-based policies, evidence-informed policy, which is correct, because they have to think about many other issues in that decision. And so the ability to understand and to move forward the issue, that's one. Certainly, I do believe strongly that, we all have to find ways to mobilize, as they have done, advocate. And I think that's what we do. We want to have all the voices to make the case, to make it truly happen. Then I think, really need to think about how to navigate the decision-making policy system. That's really important, as you know. Now we're in Washington, so how do you actually mobilize and change Congress thinking? A lot of climate issues are at the state and local level. How do you work with state and local government and even counties to look at these? So I think it takes everybody, but I think it's a little bit of push and pull. Just because we want it to happen doesn't mean it will happen. But when we really learn how to work with them, understand what they need, and make the case, I think it's more likely to happen.
But do you think that perhaps we need to look at, when we make these changes, like when I talk about for low wealth communities, this is not charity.
This
is about all of us. So that solution gets that immediate improvement. less pollution, and it benefits all of us.
Right.
So I think we need to move policy when we implement these changes. It doesn't further separate us. It doesn't stay in silos. It doesn't make, well, we're just helping these poor folks over here, when we're really helping ourselves as we, and that's what climate change, I think,
right.
does, by showing we're in one planet. So if we make these changes for the people in Bengali, the folks in where I work in Liberty City, that is helping you in these beautiful high rises in Manhattan. We're not separated. And I don't know if we could get that understanding, because then we would get policy that would move the needle immediately, because we don't have 50 years.
Yeah, absolutely.
The equitable distribution of the benefits from the transition to clean energy across all of the sectors, especially healthcare, that's what's really exciting here.
Exactly.
Is these communities can engage now and then also enjoy really the fruits of that labor. So
and all of us are enjoying the fruits of that labor, because anything that decarbonizes the world faster, we benefit.
So, if I may, I think government policy is so important. I keep looking at John Balvis, because the Inflation Reduction Act is meant to really help looking at the whole issue of carbon emission and energy. You have to put it to use. And John's organization at the HHS is really trying to, we work along with him to inform people how to use this, take advantage. These are important policies at the federal level, right? There are many policies at local level which are important. And I think Garud asked a question about CEOs of hospitals saying, I'm just too busy and too much money, I have to fight COVID, I got work shortages, how to do this. So we have to make the case for them. And the Academy, our collaborative, have done a business case to show that, in fact, when you do this and you change renewable energy, you do things, you actually save money rather than cost more money. But you have to mobilize leadership and all the way to the ground, right, to make this happen.
So, absolutely, and that is the United States. And so the United States has been leading with the Biden administration on a global scale in terms of showing what can be done domestically. And it's critical that we see these similar types of initiatives take off in other countries. But why do we care? So I'm going to throw this to you, Dr. Basu. Why do we actually care about the health of an individual in Calcutta, India? Why does that matter for the United States and our domestic policy?
Well, I think there's different layers, I think, of the way I think of it. First of all, if we, again, I think about the migration and conflict that is developing out of the stress of extreme heat. Of people, we're not ready for massive migration, which is on trajectory right now, with places not being inhabitable, people running out of water, people not being able to grow their food. So the stability of the world really relies on us being ambitious about climate solutions. So there, I want to make the argument it is in our self-interest as a country to invest in global solutions. And you all might say I'm naive and in a cynical time, but I just as a doctor, I want to put the message forward too, and I think actually doctors and health professionals are well positioned to do it, that I want to make the argument that we do care. I mean, I actually think human beings are wired to take care of each other and to look out for each other, and that if we stop, whether it's this community in the U.S. versus that community in the U.S. or sitting here in New York versus across the world, I think the power of loving our children and believing that children around the world have a right to thrive and have an education and have an opportunity, I think people really believe that. And I think we don't give enough time to saying, yes, care about that child in sub-Saharan Africa, care about that child in West Bengal, because you see their humanity. I think we go too fast past that argument, and I actually believe that we react and say, that's not right. That's not right that someone would be in danger, that families are fleeing from these kind of acts of God, and that my lifestyle here in the United States is contributing. I should do something about that. I want to make that argument too.
Right, because movements of people is one of the impacts of the planet warming. And there's so many others. As somebody in public health, epidemiology, just the study of how diseases are moving around the world. All of these things are interconnected and rapidly accelerating because of climate change.
Can I say one thing? the reality, the responsibility is on the West. When you look at who's producing, and over the last hundreds of years, where was all this fossil fuel and all this pollution coming from? It wasn't from sub-Saharan Africa. It wasn't from the less developed world. Yet they're experiencing the brunt of all these extreme weather events. So when you look at the flooding, the deaths, the wildfires, everything. So we care, yes, but we're also responsible.
Right.
And I think as humans, we need to step up with our responsibility, because that's what we have taught our children to do, and that's what we as adults should do. So I agree that it's part of our value system to care, but it's also part of our value system to take responsibility. We, the West, have caused a lot of this that we're now enduring.
And so it's organizations that represent healthcare in the United States, like AMA, that are part
National
of this.
Academy.
National Academy.
National Academy. I'm sorry. And so the contribution to the bigger global discussions and partnerships, like the World Health Organization, for example.
Absolutely. Well, first of all, it is about humanity. It's about solidarity, no question. We learned during COVID-19 and many other, that health, the world is interconnected. So when you look at climate change, clearly now when you think about whether it's Bengali, whatever, those people affected are more likely to end up with zoonosis, infections, and then you can in fact be worried about another outbreak pandemic. Look at Mpox, which is quite amazing, right? It's happening in front of our eyes. But I think that from an even larger geopolitical issue, it's also about world stability, world order, and many of these things happen in conflict areas, conflict zones, right? And people are suffering. And if we don't really try to work the right way, then you're going to have a world order that's really totally chaotic. So there are many, many reasons to do this.
So we haven't gone to the mental health aspect of this yet, and it's always that elephant in the room that is not talked about, increasingly more talked about, which is good. But when we think about health, it is both, it's that holistic approach. So all of this is increasingly discouraging to many groups that are not reaping the benefits, like you're saying, some of your patients, Dr. Basu, that aren't really, they're not actually seeing what's happening at that day-to-day level, and they might not see opportunity anytime soon for them. So how do we think about the impacts of climate, not just in terms of physical health, community health, but also the mental health of these different communities?
Can I maybe list out a few of the ways that climate is impacting mental health? So the first one I think about is heat. Studies there's a big study that came out of BU School of Public Health a few years ago that emergency room utilization of mental health services increased a lot. Mood disorders, schizophrenia, suicidality, gun violence, aggressive behaviors. So when it's very hot, we don't do well. And actually, if you invest in tree canopies, a lot of things like gun violence actually decrease. So heat is at the middle of it. There's the displacement issues of extreme weather events, and a lot of Dr. Holder and I patients are very tenuous. They might get through one extreme event, but they become homeless with another one. And so there's issues of PTSD. There's issues of individuals with underlying mental health issues who are very tenuous, where these climate shocks tip them over, where they're extremely vulnerable or are not able to survive these kind of things. And then I think we got to address this. I mean, I feel it. The over kind of feeling of kind of climate anxiety, eco anxiety. As a parent, my kids are in the front of my mind also. So there's a generation of young people wondering if they'll have a future. And I think there's so much to say about that. But I also think a part of this conversation, all the misinformation out there, the messages that the world's going to end in 2030 and all that needs to be combated too. And so we need to show leadership of explaining how we're going to make a future worthy of this generation. But again, as doctors, I think we feel real responsibility for being communicators about this. But I'm really concerned about kind of the despair that the youth have. Foundation is right, but also sometimes the evidence is wrong of kind of where they're taking it also.
And so the next generation is uniquely suffering from this, but especially the next generation of color. So it's insult on injury in terms of the experiences that those demographics are having. Can you speak to that?
Yeah, absolutely. I was at a conference and a Gen Z, or around that age, I was getting about in her 20s. She had a slide, and it said, "Adults will die of old age, and we will die of climate change." And I was taken aback because that was a phrasing that I know, but I felt, my God, she's in her 20s and that's how she experienced the world. And I was fortunate enough when I was at that time, I was all excited about everything. But I did come up at a time of, learned all these crashes and huge debts and all the stressors and everything we get on the news constantly. And the real issue of climate change hadn't really hit. So I see that level of anxiety and despair, and I say, but then I bring my patient's world into it, who have always lived with different calamities. Maybe we call them extreme weather, but lots of calamities. And how they find ways. And that's what I tell them. We will find ways because, look, I was in HIV pandemic. 30 years later, we're almost at we're not at a cure, but we are undetectable, untransmissible. You don't have to get it. We just got a shot that can prevent it. 2 shots a year. So that's 30 years. So I said, let's reevaluate how we see it, because I recognize it, but that's how my patients do it every day. Every day they reevaluate and they see the joy and they see the little incremental changes that propels them forward. That's what we need to do with our young people. So they don't show a slide that says, I'm going to die of climate change, you'll die of old age. But it's real. Please.
Well, mental health is under-recognized as one of the major issues with climate change and health. And, that's because people can't make that link sometimes. But if you live in Africa, elsewhere, you realize those who are actually living through drought or Pakistan flood, right? How they make their living. Indigenous people have to make a living through the land. That's really stressful. That mental health actual problem is everywhere, but not fully recognized. And in this country, what's really interesting, of course, as you heard from Cheryl and Bazu, of course, and many of the patients are greatly concerned about, wow, in New York City it's going to be 95 degrees, what am I going to do, right? How am I going to live through this? Or water, for that reason, in places where there's inadequate water or contaminated water. I mean, this issue is very stressful. What I think is really encouraging is young people talk about this. My grandchildren talk about this at dinner table.
Nice.
Right? Said, grandfather, are we going to have a world to live in, with all this stuff? But I think it's great. So I think stigma is a really important issue to overcome for people able to say, I feel stressed. I want to say about Brazilian workers, because American workers are facing shortage because of burnout. And a big issue of burnout is, in fact, mental health issues, right? And as a doctor myself, used to think, well, how can I show my weakness? How can I tell people I'm really feeling stressed? I need some sleep, I burn out, right? And so we need to really work alongside understanding. And the emergency room that you talk about, and you probably face this, doctors seeing. So a story we heard at the April meeting that we had a Health and Climate Day. One emergency physician says, during Santa Rosa fire, he was managing patients in the emergency room. He got a call from his daughter, said, Dad, our house is on fire. Mom's running in there to save the pets. And he was trying to navigate the two. He can barely say, are you all right, when he has to take care of another patient coming into his room. That is another resilience that we need to think about. So there's a lot of this mental stress issue that we all need to deal with.
So I think I'm glad we were able to cover that. I think, as you said, it's not discussed enough, and it's a fantastic point to end on. As a behavioral scientist, one of the best ways to reach audiences and to reach policymakers is being trusted by them. And you are 3 very trusted advocates from the healthcare sector, and please continue advocating and communicating, because we need these trusted voices to get out there. And those of you who work in this space, communicate, because it does work. This angle on health in addressing climate will go far and will continue to build out policy that makes the IRA just the start, not the end. So thank you all so much for your contributions and participation and engagement, and of course to the panelists for their expertise and advocacy. Thank you, Dr. Basu, Dr. Holder, Dr. Zhao. Appreciate it.